4 itchy spots on the body that may reveal serious health problems and shorten lifespan after 60. As we age, our skin changes. It becomes thinner, drier, and more sensitive. Many seniors assume that itching is just a normal part of aging, but that's not always the case. In fact, certain itchy areas can be your body's way of alerting you to a deeper, more serious health problem. If you're over 60, chronic itching in specific areas might be a red flag. It could be a symptom of an underlying condition that needs immediate attention. Here are 4 common itchy spots on the body that older adults should not ignore, and what they might be trying to tell you. 1. Itchy lower legs, circulatory issues, or diabetes warning. If you're over 60 and find yourself constantly scratching your lower legs, especially around the shins and calves, you're not alone. Many seniors experience itchiness in this area, but it's a symptom that often gets brushed off as just dry skin. The truth is, when itching persists and isn't relieved by moisturizers or changes in soap, it could be your body's way of waving a red flag. Why the lower legs? The lower legs are far from the heart, which means they rely on strong, steady circulation to get the oxygen and nutrients they need. As we age, blood vessels can stiffen or narrow, making it harder for blood to reach the extremities. This can lead to chronic dryness, irritation, and itching, even if your skin looks completely normal. One of the most common culprits behind this is peripheral artery disease, PAD, a condition in which arteries in the legs become narrowed or blocked. PAD reduces blood flow, depriving your skin of the nourishment it needs to stay healthy. In seniors, especially those with a history of high cholesterol, high blood pressure, or smoking, PAD can quietly develop without causing pain, until symptoms like itchy legs appear. You might notice the skin on your lower legs becoming dry and tight, even shortly after applying lotion. Shiny or thin-looking, which happens when blood flow slows and skin structure changes. Cold to the touch, even when the rest of your body feels warm. More prone to cuts and bruises that take longer to heal. Another major factor is type 2 diabetes, which becomes increasingly common after age 60. High blood sugar damages the nerves and blood vessels over time, often starting in the legs and feet. This damage, known as diabetic neuropathy, can cause sensations that include itching, tingling, or even burning. If you also experience frequent urination, increased thirst, or blurred vision along with the itching, it's especially important to get your blood sugar checked. Keep an eye out for the following warning signs. Tingling or numbness in the feet and lower legs. Hair loss on the shins or tops of the feet, a sign of poor circulation. Swelling around the ankles. Leg fatigue or cramping, especially after walking short distances. In some cases, what looks like a minor skin issue can lead to serious complications if ignored. Poor circulation combined with itching and scratching can break the skin, creating an entry point for infection. Seniors with diabetes are especially vulnerable to foot ulcers and other slow-healing wounds, which can escalate quickly without proper care. When to see a doctor? If the itching on your lower legs lasts more than a couple of weeks, doesn't improve with over-the-counter creams, or is accompanied by the symptoms listed above, it's time to get checked. Your healthcare provider may recommend an ankle brachial index, ABI, to check for PAD, blood sugar testing, including a 1C for long-term glucose control, a skin assessment, to rule out other causes like eczema or fungal infections. A review of your medications, as some blood pressure or cholesterol drugs can cause itchiness as a side effect. What you can do at home. While you're getting answers, there are steps you can take to relieve itching and support better leg health. Stay hydrated to keep your skin supple from the inside out. Moisturize daily, using fragrance-free creams or ointments rich in ceramides. Wear compression socks if your doctor recommends them. They can improve blood flow and reduce swelling. Keep blood sugar and blood pressure under control through diet, activity, and medication if needed. Avoid scratching, as tempting as it is, it only worsens the irritation. Itchy lower legs aren't just a nuisance, they're a message. If your legs are itching more than usual, especially without a visible rash, don't ignore it. This could be your body's way of alerting you to circulatory problems or early signs of diabetes, both of which are common in older adults but manageable when caught early. 2. Itchy scalp, a possible sign of kidney trouble, nerve damage, or shingles. If you're over 60 and dealing with a scalp that just won't stop itching, especially when there's no visible dandruff or skin condition, it might be time to look beyond the shampoo aisle. An itchy scalp in older adults isn't always a minor annoyance. In some cases, it can be one of the earliest signs that something more serious is going on inside your body. Let's start with the less obvious, but more concerning possibilities. Chronic kidney disease, CKD, and itchy scalp. Itching is one of the lesser-known symptoms of chronic kidney disease, but it affects a large number of people in the later stages of the condition. When your kidneys begin to decline in function, something that becomes more common after age 60, they lose the ability to properly filter waste from the blood. These waste products begin to build up and circulate through the body, irritating the skin and triggering itchiness. While itching can appear anywhere, the scalp and back are two of the most common areas affected in seniors with kidney issues. The itching may come and go, feel worse at night, or appear without any rash or visible irritation. Here are some kidney-related signs to watch out for. Itchy scalp without any flakes, dryness, or redness. Persistent fatigue or unusual tiredness throughout the day. Swelling in your ankles, hands, or face. Changes in urination, including frequency or color. If you have high blood pressure or diabetes, two of the most common causes of chronic kidney disease, and you're experiencing an itchy scalp alongside these symptoms, don't wait. Speak to your doctor about getting your kidney function tested. Nerve damage and itchy sensations. Itchy skin can also be neurological in nature, meaning the problem starts in your nervous system, not your skin. In seniors, this is especially important because nerve-related itching often occurs after a stroke, as part of diabetic neuropathy, or in cases of pinched nerves in the neck or spine. This type of itching feels different. It may come with a burning or tingling sensation and can be extremely localized. For example, just one spot on your scalp or one side of your head. And because nerves are involved, scratching doesn't really relieve the itch. Common nerve-related signs include itching that feels deep under the skin, not on the surface. Numbness or tingling in the same area. Weakness or coordination issues in nearby limbs. No visible rash or flaking skin. Neurological itching needs medical attention, especially if it's interfering with your sleep or daily life. Your doctor may refer you to a neurologist or order imaging to check for nerve damage. Shingles often starts with itching. Many older adults are familiar with shingles, a painful blistering rash caused by the reactivation of the chickenpox virus, varicella zoster. What many don't realize is that before the rash appears, one of the first symptoms is itching, tingling, or burning in a very specific area. And yes, this includes the scalp. Shingles usually affects only one side of the body and follows a nerve path. If you're experiencing intense itching or burning on one side of your scalp or face, especially in a straight line or band, you may be developing shingles, even if the rash hasn't shown up yet. Early signs that may point to shingles. Itching or tingling localized to one side of the scalp. Sensitivity to touch or pain in the same area. Mild fever, fatigue, or headaches. Redness or rash appearing a few days later. Shingles can be very serious for seniors, particularly if it appears on the face or near the eyes. Getting early antiviral treatment can reduce the severity of the rash and lower the risk of long-term nerve pain. postherpetic neuralgia, a complication that can be debilitating. So when is it just your scalp? Of course, not every itchy scalp signals a health crisis. Dry skin, allergies, stress, or a reaction to new hair products can cause temporary itching. Hormonal changes and age-related skin thinning can also make the scalp more sensitive over time. Still, here's the bottom line. If your itchy scalp lasts more than a couple of weeks, doesn't respond to over-the-counter treatments, and is not accompanied by visible signs like flaking or redness, it's best to get it checked out. What seniors can do. If you're 60 or older and struggling with unexplained scalp itch, here are a few steps you can take right now. Track your symptoms. Make note of when the itching happens, whether it worsens at night, and if it's in the same location every time. Check for other signs. Are you more tired than usual? Noticing swelling or changes in urination? That could point toward kidney involvement. Consider your medical history. If you've had a stroke, have diabetes, or recently dealt with high blood sugar levels, nerve-related causes are more likely. See a healthcare provider. Don't delay. Blood tests, neurological exams, and even a skin biopsy may help identify the root cause. Remember, itching is a symptom, not a diagnosis. It's your body's way of telling you something may be off. In seniors, that something might not always be skin deep. Itchy scalps in older adults can stem from something as simple as dry air, or as serious as kidney disease or shingles. Understanding the differences, especially when there are no visible symptoms, is key to catching potential problems early. As you age, your body sends signals in new and sometimes surprising ways. Pay attention to those signals. Whether it's an itch, a twinge, or a sense that something's just not right, don't brush it off. You've earned the right to age with comfort, clarity, and confidence. Listening to your body, yes, even when it's whispering through an itchy scalp, is one more way to protect your health and enjoy the years ahead. 3. Itchy back, liver disease or blood disorders. Itching on the back, especially the upper or middle back, can also indicate something going on internally. The liver plays a major role in removing toxins from the body. When it's not functioning well, bile salts can build up in the bloodstream. These salts irritate nerve endings in the skin, which can cause intense itching, often without a rash. This type of itching is most common on the back, arms, or legs. In some cases, itching on the back can be an early symptom of Hodgkin's lymphoma, a type of cancer that affects the lymphatic system. Though rare, this form of cancer has been known to cause itching that doesn't go away, often long before any other symptoms appear. Things to watch for: itching at night that worsens when lying down, yellowing of the skin or eyes, jaundice, fatigue and unintentional weight loss, night sweats or unexplained fevers. Liver issues and blood disorders are serious. If your back is itching constantly and nothing seems to help, don't dismiss it. Ask your doctor for a liver function test and a full blood panel to rule out anything serious. 4. Itchy hands and feet, gallbladder or hormonal problems. When the palms of your hands or the soles of your feet itch frequently, it can be a sign of issues with your liver or gallbladder, especially if you've had problems digesting fatty foods or have experienced bloating or nausea. In some seniors, these symptoms indicate cholestasis, a condition where bile flow is reduced or blocked. When bile can't leave the liver properly, it backs up into the bloodstream, leading to itching in specific areas like the hands and feet. Itchy hands and feet can also be linked to hormonal changes, especially those related to thyroid function. Hypothyroidism, which is common in older adults, can cause dry, itchy skin, often concentrated on the extremities. Watch out for itching that worsens at night. No visible rash, but a deep, persistent itch, nausea or pain after eating fatty foods, fatigue, constipation, or sensitivity to cold. If you have these symptoms, your doctor may suggest a liver function test a gallbladder ultrasound, or a thyroid screening. Itching may seem like a skin problem, but often it's just the surface signal of something happening deeper inside the body. When should seniors worry about itching? While occasional itching is normal, especially in the winter months, seniors should be alert to the following signs. Itching that lasts more than 2 weeks. No visible cause or rash. Itching that interferes with sleep. Itching combined with fatigue, weight loss, swelling, or jaundice. In older adults, these can be early signs of diabetes, liver disease, kidney disease, blood disorders, and nerve damage. Catching these conditions early makes treatment more effective and helps prevent long-term complications. What seniors can do. Here are a few ways to reduce itching and stay ahead of serious health issues. Drink plenty of water. Dehydration can worsen itching and cause dry skin. Use fragrance-free, gentle moisturizers daily. Avoid hot showers, which strip the skin of natural oils. Use mild, unscented soaps and detergents. Keep track of any new medications, as side effects can include itching. See a doctor if the itching continues or is accompanied by other symptoms. Seniors should also get regular health screenings, including blood sugar tests, liver and kidney function panels, thyroid screenings, cancer screenings based on personal and family history. Staying informed is one of the best ways to stay healthy. Don't ignore the signals your body is sending. A simple itch might just save your life. Conclusion. Itching may seem harmless, but in seniors, it's often a sign of something more. If you or someone you love is over 60 and experiencing persistent itching in specific areas, like the lower legs, scalp, back, or hands and feet, take it seriously. Your body has its own way of communicating when something's wrong. Listening to it can make all the difference. Regular checkups, lifestyle adjustments, and early intervention are the best ways to maintain health, independence, and quality of life in older age. Stay informed, stay aware, and don't ignore what your skin is trying to tell you.